details about or explanations about our simplified Kundalini exercise, and we are going to do the demo parallelly, and we will see the benefits of each and every postures and movements in the exercise, and that's what we're going to see. So as a session overview, we're going to understand the need of the exercise. There is a saying that if you are not moving your body will get into dis-ease quick. And if you are moving your mind so often, then your mind will go into dis-ease. So it is directly like, it is directly opposite actually. So if you have to keep your body active, you have to move your body often. So in this current modern world, we are trying to modernize the world to keep our daily routine simple. And we in this digital world, we got everything what we need just by clicking a button, which is really great, but we slowly lose the conscious about importance of moving our body, which is activities that leads to a lot of problems today. So we have to get into a physical regime where we have to move our body in an effective way, a less motion or simple motions, which gives more effect. So that is, and in very less time. So to combine everything, our beloved Guru Yogiraj Vedatri Maharishi spent his 40 to 50 years of his lifetime to research on this specific um, physical health, and he created a systemized, simplified physical exercises which can be done from the age of 8 to 80 years, and anybody can do this. It is very simple motions, and it gives great effect for the physical, the peripheral physical health, as well as the internal organ health as well. So that is the greatness of our Guru, who spent his lifetime to get this systemized and given to our human society. So we should be very grateful to our Guru, and let us all get his blessings to go ahead and get the understanding of the specific simplified exercise regime. Our body is consist of 5 different elements: the earth, water, fire, air, and akash, which is life energy particles. So combination of these 5 elements and the coordination of these 5 elements helps to maintain our body as well as our living. So we need to regulate the 3 important circulations in our body, which helps to have a natural harmony between the life energy and the physical body. The 3 flows which we are going to concentrate and correct in our simplified physical exercises are the flow of blood circulation, the flow of breathing, and by these two, we will generate heat in our body, the flow of heat. So by maintaining these these three in a proper proportion, which makes our body have a very great harmony between the life force and the physical body. That is the high level overview of our simplified physical exercise. And we'll go through the guidelines and postures and movements by in the next slides. Let's move on to the next slides. So we discuss about the importance of physical health in the modern age. Let's go through them. Um, the physical labor work has largely reduced in recent times. We all know that in this digital world, we get everything quick with the improvement of our inventions through science and technology. So machines have replaced manual labor work. Manual labor work, if at all done, is only for few selected parts, and that too only minimally. Elaborate, complicated yoga systems of old days cannot be followed in these stressful times. Sound body is required for strong mind. Hence, physical exercise is a most and must for successful meditation. And suitable simplified exercise schedule is needed for modern age with a time limit. So our simplified exercise is developed by Sri Yogiraj Vedatri Maharishi after years of intense research. Various exercise practices were evaluated and best was taken to create the systematic simplified physical exercise. Exercises are based on body and mind science. Harmony between body cells and life force is very important for body and mind health. Proper blood circulation, heat circulation, and air circulation maintain the harmony between body cells and life force. The exercises we are going to learn focused on streamlining these three circulations. And these exercises are so gentle, easy to practice, and no side effects, even. And it covers the entire body organs, internal as well as external. And guidelines for simplified physical exercise. The age limit to learn and practice is 8 to 8 years, and the time taken for these whole simplified exercise is 40 minutes daily. And we have to practice this on a mat or a thick spread, not in an open air space, to be done on empty stomach 4 hours after food and half hour after liquid drinks. Women not to do during monthly cycle. Pregnant women after 2 months of pregnancy should not do the following exercises until delivery. We'll look at that when we are going through the exercise. Those are like posture 1 and 2 on neuromuscular breathing exercise, and part A and B of Makarasana. So the components of simplified physical exercises are hand exercises, leg exercises, neuromuscular breathing exercise, eye exercise, Kapalapati, Makarasana, massage, Acupressure, and relaxation. Let us see the demo of hand exercise and then we go through the benefits of it. Ayya Shivakumar Ayya, if you're available, please share your video so we can start on Ayya.
Sure. One second.
Let me stop sharing it so you can share your be blessed by the divine Ayya.
Be blessed by the divine. Quiet problem, madam. Are you able to see me?
Yes,
or you
Ayya.
want to make me vertical or landscape is fine?
It is pretty clear, Ayya. We can go ahead. Yeah.
Quiet
So,
problem, madam.
Ayya, I will give an instruction. You just follow it, Ayya. If you want to tell something, you can intervene me and then explain it, Ayya.
Sure.
Thank you, Ayya. So we are going to be standing in like how Ayya stands now. So we have to have an half-inch distance between the two legs, and like 15 centimeter distance, and then stay um, erect. Keep your body relaxed, and the first posture is bring your hands above your head from the side of your body, and make sure your hands are touching your ears, and take 4 deep breaths. One, two, three, four. And bring down your hands slowly, bring it back to your body, and then take 2 breaths. One, two. Repeat the same for 2 more times. Raise your hands above your head, take 4 deep breaths. When you do this, make sure that your focus is on your shoulders, where all the bloods in your hand is drawn to your shoulder, and it'll be pumped all over the body. So the blood stays on your hand, will be circulated. As a human being, we have very less options to um, uh, raise your hands above your head. This is the main reason why we have this. So yeah, we can bring down a, yeah, and then you'll do 2 breaths. If you do slowly and then concentrate on the flow, you will see a flow of blood down to your fingers. So we have to do it 3 times. So next, we are moving on to the next posture. So spread your hands sidewise from your body. Take a deep breath, and then bring back both the hands front of your body. And when you're doing this, exhale slowly, and then inhale and spread the arms again. And exhale slowly, bring the hands in front of your body. Do these things for 5 times. This is posture number 2. So during this motion, we are trying to supply prana to our lungs and get a maximum expansion of our lungs. So the blood's drawn, or the blood's circulated by moving your hands above in the previous posture, is being oxygenized through this posture. This is posture number 2. The posture number 3 is bring your hands and like combine all the like close, like bring all the fingers together. Aya, you can show how it looks, Aya. Yeah. Bring all the fingers together and hold it like this, and start rotating your right hand backwards. One, two, three. When you are rotating, make sure that your knees are not like your hands are not bent, and try to touch the right ears, and do it for 5 times. The main and very important thing in our physical exercise is that your breath should be normal, and your focus of mind only should be in your body. So we are going to do the left hand now, holding the fingers the same way as we did on the right hands, and doing backside rotation for 5 times. And the things to note here is not to bend your hands, and not to bend your elbows, and make sure your hand is touching your ears during this circular motion. Do this for 5 times. And now we are going to move the right hand from back to front. One, it's an opposite circular motion. Two, 3, 'Same way we are going to do it on the left hand. Back to front. 1, 2, 3, 4, and 5. Now we are going to hold both these hands and going to swing back to front. Back to front. Yeah. 1, 2, 3. So when you're doing it, again, we have to make sure we are not bending our elbows and try to get as close as possible to your ears and stretch it back and forth. All these exercise so far, we have to make sure that we close our eyes and continue focusing on our motion of hands. Now we are going to do back to front. 1, 2, 3, 4, 5. And now we are going to do the next posture. Bring your right leg and a feet in front of your left leg. Keep your right hand raising in front of your body, left hand back, and start doing backward swimming. 1, 2, 3, 4. Very nice, yeah. So when you're doing it, you need to do very slowly, like what Aya is demonstrating now. And we are going to be in the same posture and then do a front swimming, front paddling of swimming. 1, 2, 3, 4, 5. So next is the next posture is what we are going to open our eyes. So bring both the thumb fingers in front of your eyes, like just below your nose, and make sure both your legs are 1.5 feet apart, and press your right toe, left toe, and turn right side, and make sure your eyes are looking at the fingers, and then turn other side, pressing your right toe on the floor. So this is one circle. So you have to do this for 5 times. 1, right side and left side. So when you do this, our nadis are starting from our um, the toe of our right and legs, left legs. And when we are doing this twist, it gives a gentle twist on your spine, as well as it ends on both the eyes. And it so by looking at this 2 fingers and rotating it, it helps to regularize our nadis in our body. So do this for 5 times. So next posture is make 2 legs like 3 centimeter apart, and then hold your knees with your palms and do a clockwise rotation. 1, 2, 3, 4.
I think, yeah, 3 times count. Yes.
Okay, 2, 3.
You count clockwise 3 times.
Clockwise 3 times. So it starts with clockwise, and then anti-clockwise, and it ends with clockwise. So this is the end of leg exercise. So the points to note here is you need to close your eyes throughout the exercise, except the um, posture where we are twisting our spine. That's the posture we open our eyes. And when we do this, we need to do it gently, slowly, and concentrate your mind on your body, your eyes closed. Thank you so much, Aya. Let's look at the benefits and then we'll start with the leg exercise, Aya. Thank you. Thank you, Aya.
Welcome.
All right. So we have seen all these postures. Let's move on to the benefits. So this is just a demo of like when you are raising your hands above the vein, the blood flow is empty, and then when you're bringing down through the circular motion, your veins are filled with the blood. So benefits of hand exercise: improve bone joints and muscles in the hands, lubricates the joints, facilitating easy movements, strengthens muscles with fitness and endurance, corrects wear and tear of joint muscles, prevents frozen shoulders. Next, we have a knee exercise specifically on the hand exercise flow, and so we have a demo for this. So the main thing which we have to note down is 3 times clockwise, 3 times anti-clockwise, and we are ending it with 3 times clockwise. And each leg should be separated 3 inches apart. It's not 3 centimeters, it is 3 inches apart. And then we have the benefits for, so the posture we do on before the knee exercise, right? It strengthens the back muscles, prevents catches, anatomy preserved. So, and the knee rotation prevents the arthritis of knee joint, preserve the normalcy of the knees. Benefits of knee exercise: circulation of blood, heat, air, and life force in hands and arms becomes normal and regular. Hands and shoulders are strengthened. Arthritis and conditions where the limbs become numb during rest are reduced and possibly cured. Pains in shoulder joints and knee joints are cured. Trembling of hands and pain in finger joints are cured. Let's move on to the leg exercise. Yeah, we can see the demo and then go through the benefits. Yeah.
Welcome.
Thank you. Yeah. So this is the starting posture of our leg exercise. Keep your hands and besides your body, and make sure your palms are outwards, like looking outwards, and hold it, and keep the two legs apart for 1.5 feet, and start start the motion outward to inward, where both your toes are touching the floor, and make sure your knees are not bent, and Aya is doing very nicely. So bringing the legs inward and then extending back outwards is one, and we have to do this for 5 times. 2, 3, 4, and 5. So this is number one posture. By doing these motions, it helps from the hip to the toe of our leg. It regulates the blood, air, and heat circulations of leg. And the posture number 2 is like move both the legs a feet apart, and then start with right side, both legs on the right side, and then left. This is number 1, and do this for 5 times. 2. The things to notice: keep your hands on the floor in a supporting posture. Don't bend your elbows. Close your eyes and watch the leg movements keenly. Concentrate the leg movements. Do this for 5 times. And next is the leg rotation. And the same distance, start doing the clockwise rotation. 1, 2. So you have to extend it outwards and then try to bring both the legs inwards. Do a clockwise rotation 5 times, and then do an anti-clockwise rotation, and then ends with the clockwise rotation. 1. Aya is doing anti-clockwise now. 2, 3. So you have to do it like how Aya is doing. You have to stretch as much as you can and then bring it back. And when you're doing it, make sure, and you have to complete it with the clockwise. So Aya is done with anti-clockwise, and Aya is going to do the clockwise now. 1, 2, 3. Yeah. This is posture number 3. Now we are going to see a foot reflexology, where we are going to take our right leg on top of your left leg thighs and make sure your bottom portion of your leg is outside of your left leg. And we are going to keep all the 4 fingers on the front side of your leg, and then keep the 2 thumb fingers on your fingers, toe fingers, where you're going to start doing a gentle press on the thumb, like toe finger, where we have the pituitary, pineal glands, and the sinus points are on the sides of the toe. We are going to give a gentle press, and then we are going to move on to the next 2 fingers where it's for eyes, and we are doing the same. And below your fingers there is a gentle portion where we have to press it a little slow, and we can press it harder on the top of the fingers. And then next we are moving on to the next 2 fingers for ears. We're doing the same. And then we are going to do a zigzag motion on the bottom portion of our legs, from the top to the bottom. Do a zigzag and do a gentle press. So the reason why we have this foot reflexology is to make sure we are giving the nerve ending portion of our internal organs and the physical body in your foot, and it stimulates the internal organs. So look at how Aya is doing. Aya is doing like a zigzag motion of pressing. And when you come to the middle portion of your legs, you have to press it gently, that specific portion. And because we have all our stomach internal organs over there, so we have to give a gentle press than what we are giving on the top portion and the bottom portion of our legs. So we are doing this zigzag motion from the top to the bottom. So each and every press is inducing a specific portion of our internal organs as well as the physical body parts. So we do this zigzag, and when we go to the bottom, we can give as much as pressure we can on the bottom heel of our leg. And we are going to press from top to bottom, the side portion. This specific press is for our spine. So give this press on both sides. We're using our um, thumb on the top and all other four fingers on the bottom and doing this press. This gives good pressure on the spine. And we are going to do, there will be a knee on the heel where we are going to do a circular motion. So the thumb will be, both the thumbs will be the top portion, all the four fingers will be bottom of this particular movement. We are going to start circularly pressing it from bottom to top and then move from top to bottom. So we have to do this press. So this is the place where we have all our sexual organs, nerve systems are ending. By giving this gentle press, it will help to have a proper function of our glands on sexual organs. So we do these circulations, and then keep the right hand palm on top of your right leg, and then left hand palm on the bottom. Do a circular motion on the same bone, like clockwise and then anti-clockwise, and do a clockwise. One, two, three, four. Yeah. And
Yeah.
keep your right hand in the bottom of your right leg. Look at how Aya is doing, and hold the portion of leg
Those
like this, and hands to be pressing the thigh of right leg as well. And then start doing clockwise rotation, and then do the opposite rotation of your leg 5 times, and then anti-clockwise, and then clockwise. One, two, three, four, five. And now we are going to do a gentle press on the legs, where we have all our nerves, troubler vein system on our calves are there. So we are giving a gentle press from bottom to top, and then go along with thighs. And we have to do this for 3 times. One, two. The main important thing is you have to concentrate on your body. Your concentration should be on your body, and the motions what we are learning here should be gentle, slow, and that's very important. um, Aya is doing very nicely. Thank you, Aya. So let's go ahead and stretch the right leg, and we are going to do the left leg. It's going to be the same way, but we will see it quickly. So keep the left leg on the right thigh, and we are going to start the pressing the same way.
press and
Start,
release the big toe.
yeah, big toe, and then we are going to move on to the other
Toes.
two. These are for eyes, and the next two are for ears.
Last two toes.
Yes.
Then zigzag manner left to right.
Yes.
Right to left. Come down. Left to right. Press on all parts of your foot.
So when you do this press, you need to imagine what are all the parts in the um, foot areas where we are pressing. We are going to see that in our slides, and then get an idea of what are all the parts we are pressing. Applying those thoughts along with this press will help us to induce the portion of the body in a nice way. And then we are going to do the same on the spine press, where we are going to do squeeze our legs on the sides. This will give a gentle press on the spine. We are starting from top to bottom, and then from bottom to top, and we are ending with top to bottom. Yeah. And then we are going to do the same circular pressing, where we
Thank
have
you
all.
on the ankle portion. Yeah.
Yes, there will be a bone on the ankle portion where we are circularly pressing it, and the two thumb fingers we are seeing is on the top portion, and all the four fingers are parallelly pressing the bottom portion of the ankle. I is doing that. So you have to do this for like from bottom to top, top to bottom, and bottom to top for 5 times, and then placing the left hand on the left leg top ankle
Fine.
side, and then do a clockwise rotation
3 times, then counterclockwise 3 times.
times, and then clockwise 3 times. And hold the left leg with your left hand, and hold
Hold the
the
pose with your right.
right, and then do a clockwise 3 rotation,
Two,
anti-clockwise.
3, 4, 5. Counterclockwise 1, 2, 3, 4, 5. Again clockwise 1, 2, 3, 4, 5.
Then
Massage
open.
leg and thigh
Mhm.
using both hands.
So we have to start from the bottom of the leg all the way up to the thighs, and we should start again from the bottom of the leg to the thighs. So we have to do this for 3 times, and then we can stretch our legs and relax it. Yeah, you want to show the kidney massage along with the leg exercise? We
Yeah.
can. Look at how Aya is sitting. This is called Vajrasana. In this Vajrasana, you need to make sure
Right big
that
toe on the left big toe.
yes, right big toe should be on the left big toe, and have a nice seating uh, um, posture on your leg ankles. Sit like this, and this is called Vajrasana. Now Aya is going to show how are we going to do kidney massage. On this seating posture, our both kidneys will hang in an hanging perfect posture. So we are going to hold our hands like how Aya is showing. All the four fingers should be,
Drop down all the way.
yeah, down.
Raise up and then massage along the spine and then drop down. Again,
Yeah.
raise up as much as possible. Bring down along the spine.
We are doing this for 5 times, and yeah, this is our kidney massage. And next, we are like going to do the Chinmutra, like um,
Like
connect
this.
thumb
Thumb
and
and index finger.
make a circle like that, and that's called Chinmutra, and hold it between the leg and the lower abdomen, um, and hold these two fingers there. Yeah, can you do a kneel down
Yeah.
and then show where you're placing it? Do a kneel down.
Yeah.
Do
Leg. Yeah.
yeah, and show where you are keep. Yeah, like that you have
Yeah.
to keep.
Lower abdomen and stomach and thigh. The
Thigh,
other
yeah,
3 fingers on the thigh. And
thigh.
just keep between. Yeah.
Yes. And sit in the Vajrasana posture, and then take a good breathe in when you're starting, a normal breathe.
Inhale.
Inhale,
Then exhale.
exhale, and then
Bring the
bend.
spinal to the ground.
Yeah.
Inhale. Go back. And
Exhale,
exhale.
bring back. down.
Yeah.
Do this for 5 times.
Inhale, exhale. Inhale, exhale. Inhale, exhale. Come back.
Yeah. And the next is holding your
Adi Mudra.
yeah,
Thumb
hold,
inside the, yeah, and then cover with your fingers. Same way, thumb inside the palm and then cover with other fingers. And keep it in the lower abdomen facing up like this. So
so
lower
yeah,
abdomen, yeah, facing up.
same
Take a deep
inhale,
breath. Inhale and then exhale,
bend
bend down.
down. Yeah.
Inhale, bend up. Exhale, bend down. Inhale,
Inhale.
exhale.
Do this for 5 times. So
Inhale,
and exhale.
exhale.
Inhale.
Inhale, exhale.
This helps to induce proper pressure and gentle pressure on our abdominal region organs, which will help us to regularize our hormonal segregation on our stomach. So this is the end of neuromuscular and leg exercise. We'll go through the slides and then we'll do the breathing exercise. Yeah. Or
Yeah.
do you want to continue and then start go through
No,
the
you can look at the slides. It will
slides?
help them to, yeah.
Understand? Yeah. Thank you. Yeah. Let's go through the slides real quick for the leg exercise and the neuromuscular, which will help us to understand it along with the slides as well. So we start this leg exercise 1, and both the legs should be 18-inch apart, and bend the feet inward till the big toes touch the floor, and repeat the cycle of the same motion for 5 times. And then the next is 12-inch apart, and then turn both the feet simultaneously towards the right, so that the small finger of the right foot and the big toe of the left foot touches the floor. And then do the opposite on the L4 and repeat this for five cycles. And then the next is 12-inch apart, doing a rotation of clockwise 3 times, anti-clockwise 3 times, and then completing it with clockwise rotation 3 times. Next is foot reflexology, where you keep the right leg on the left leg's thighs and start doing the pressing.
Press and
Toes of the
release.
ankle, applying pressure, massaging, foot rotation. Use both the thumb fingers of hands, press and massage. The other 4 fingers should rest on the outer foot to help the pressure being applied evenly. So these are all the parts we need to remember when we are doing. This will give us a good sense of relaxation when we are doing this. So we have the arm and shoulder at the upper part of the um, leg, and pituitary gland, sinus are all there in the big toe, and the other 2 fingers are for eyes and then nose, eyes and ears, and the middle part of our legs are having all the internal organs like liver, spleen, gallbladder, adrenaline gland, pancreas, all intestines and other stuff. So that's the reason why we are giving gentle pressure on the middle portion of the leg, and the sides are spinal columns. And when we go down, you'll be having your legs, lower back, tailbones, and all. So just remember, so the bottom portion is the bottom right and left of our leg. So we have to remember all this and then do the press, which will give us good results. The main thing to remember is focus on our motions and movements and keep your mind just on your body and remain focused. Next is the massage. Sit in a Vajrasana posture. We explained that. And then place the right big toe over the left big toe. That's very important thing. And then keep heels apart and sit comfortably between the heels. Place hands on the back, touching the spinal column and the two thumbs on the side. Repeat this cycle for 5 times. And the benefits: legs are strengthened while performing this regularly. Blood circulations get regulated in all parts of the abdomen, cures sciatica and arthritis, strengthen the pelvic muscles and corrects backache, balances rotators of the leg, internal and external. And then foot reflexology. Human body has around 72,000 nadis and ends in foot. When pressure is given at the end points, connected internal parts get stimulated and defective functions get cured. Neuromuscular breathing exercise. So we start with this posture where we sit in a Vajrasana and do Chinmutra on both the hands and place these Chinmutra between our thighs and the lower abdomen. Fix the joint fingers between the thighs and the abdomen, other fingers over your thighs. So bend, exhale, and inhale slowly and deeply, and then start exhaling slowly and simultaneously bend forward simultaneously. Do this for 5 cycles. And the next is um, holding the fingers together and do a Adi Mudra, and then do the same as 5 cycles. Both the thumbs should be on the palms and then cover with the other fingers is called Adi Mudra. Do this for 5 cycles. And the main and important thing to mm, watch is that your neck and spinal column shouldn't be bent. It has to be straight and then uh, do a bend. So by doing this, we have all these organs are getting gentle press, which will help us to regulate the water, air, and heat circulations internally. So like liver, gallbladder, large intestine, small intestine, and stomach are getting a gentle pressure by placing the hands below your lower abdomen and then pressing it while bending will give a gentle pressure and regulates all these three flows. Next, we are going to see the neuromuscular breathing continuation, like the breathing exercise. Aya's going to do a demo. So sit in a Sukhasana where you feel so comfortable and place your left hand palm on your left hand.
Right on the navel, left on the touching the ears, across the chest, elbows gently pressed in the chest.
And then keep the left hand on the um, left hand on the right ears and hold the left front portion of your lungs and do 5 breathings gently and deeply. By doing this, as you're giving the pressure on the left lungs, the back portion of your left lungs and then the complete right portion of your lungs are filled with air, which gives proper expansion of your lungs, and the air will be filled all over the places in your lungs. Do this for 5 times and then starts with the left palm on your navel and then the right palm on your left ears. Now we are pressing the front portion of your right lungs and then do a breathing for 5 times. Now we are activating the back portion of your right lungs along with the left portion of lungs, and we are filling the air completely. And when you do with full concentration, you'll be able to see your specific portions are moving. So now we will be able to see the right back lung portion is expanding. And next is keep your left on right ears and then place your right hand on top of your left hand and place it on the left ears and press both the hands on your front chest and do a breathing. So by holding this and do a breathe, you will get expanded on both back portion by doing 5 breaths. When you're doing it, your back portion of lungs are getting expanded and the airs are filling to the back portion of your lungs as well. The ultimate goal of doing all these motions and doing breathing is to make sure that your lungs are filled with air to the maximum capacity, and then the idle portions of the lungs will be expanded by giving this simple motions, which will help to improve our breathing practice. The next posture is keeping both your palms on your ears and touch the middle fingers of both the hands backside of your head, and then hold like this and then do a breathing. By doing this breathing, the sidewise, both the sides of the lungs are getting expanded, side portions of the lungs. So by having this specific posture and then do a breathing, we'll get a good and gentle expansion on the sides, which will help the lungs to expand even on the sidewise. Do these breathing for 5 times, and then the next posture is going to be keep the left palm on the left eyes and the right palm on top of your left hand palm. um, yeah, make sure you hold like this. Always your right hand should be on top of your left hand, 4 fingers, and do the breathing. And when you are doing this breathing, you will be able to see the upper portion of the lungs are getting nice expansion. And imagine that you are filled with a lot of air on the upper portion of the lungs as well. And then do this for 5 times. And as we are doing a lot of motions with your hands, and placing these hands on your eyes will help you to increase your biomagnetic energy supplied back to your eyes. And with this, the neuromuscular breathing is completing. um, yeah, shall we see eye exercise and
Yeah.
kapal? Okay.
No, you want to see that or presentation?
uh,
Presentation, we can show the lungs so they will remember.
okay, yeah, we'll do that, and then we'll start with the eye exercise
Yeah.
again. Thank you. So now, this is what we were seeing: inhale and exhale slowly and deeply without retention of breath. That's one of the main thing which we need to remember on doing any exercise in our simplified physical exercise regime. We are not holding our breath. So whenever we are doing any neuromuscular breathing, whether it is or any other breathing we are watching on the exercise, it should be like inhale and exhale. The inhales should be slowly and deeply, and then exhale, but we should not uh, we should not do the retention of breath inside. So it has to be flow in and flow out. So number one posture is keeping the right hand on the navel, right hand palm on the navel, and then keep the left hand on the left ears and pressing the left portion of left front portion of the lungs, and then do 5 breathings. We are changing the hands and do the press on the right front portion of the lungs, and placing both the hands in the ears, and make sure your right hand is on top of your left hand, and then do a gentle press on the front portion of your chest, which will give expansion on the back side of your lungs. And do this as shown in N12 picture, keeping both the arms on the ears and then hold the hands sideways on your body and then do a breathe. This will give a side expansion of your lungs. And hold both the palms on your eyes, and make sure your right hand is always on top of your left hand palm, and do 5 breathing where you will be expanding your lungs at the top wise, like the top portion of the lungs will be filled with air, as shown in picture N12 N13. And sit comfortably in a cross-legged posture, Suhasana, and cover the navel with right palm. There is an explanation. um, so when we are doing a breathing like this, the back portion is expanding, like what is shown in the picture. By holding both the
bottom
lower.
portion of the lungs. Yeah.
So when you're doing like this, the back and side is expanding. When you're holding like this, the lower portion, the middle portion, and then the upper portion. This is how we are getting the expansion. And benefits of neuromuscular breathing: the neuromuscular breathing regulates the endocrine system and oxygenizes the blood. It ventilates the lungs and increases the vital energy. It helps curing headache, insomnia, asthma, and other bronchial troubles. Tiredness is not felt even after working for a full day. Students are benefited in their studies due to increase in absorbing capacity, retention capacity, and recalling capacity. Functioning of the nerve system is improved. These are the benefits of neuromuscular. Let's move on to our eye exercises. We'll see the demo and then start seeing the presentation with the benefits. So we are going
Please
to
begin.
sit,
Yeah, and Vajrasana.
yeah, and
Right
have a
big
nice,
toe on top of big toe.
yeah, right big toe on top of left big toe, and hold both the hands, cling both the hands like this, and then make sure your both the thumbs are up, and we are looking at the thumbs just below your nose, and hold like this. And we are doing a right side wise motion first, and moving on to left. During this motion, you need to make sure that your eyes are following your thumb nails. So we are moving right and left. When we are moving, we are doing a gentle bend on your elbows so that we will be covering the most portion of your sides. So this is equivalent to minus symbol, where we are doing from right to left is 1, and then we are doing this for 5 times. And then the next is bringing your hands to the lap, and then moving the hands from lap to top of your head. Make sure that you move your eyes, you just follow your eye, follow your fingers, and looking at those 2 thumb fingernails. You are not moving your neck, you're just moving your eyes from uh, bottom to top by looking at the thumbnails. And we are going to hold the hand um, until the end of this eye exercise, and we are doing it for 5 times. So when you are doing this, it will be looking like a cross. So, and the next is starting from the left side, and moving your hands diagonally to the um, left to right side, and then bring back. You have to do a motion of your hand in such a way that you can watch your thumbnails all along the motion from this side to the top, and do this for 5 times. The motion should be relative so that your eyes can watch the thumbnails. So you have to change the flow based on your way of looking at it, and then start from the right side, bottom to the top left diagonally. You're doing this motion for 5 times. If you see combinedly these two motions, it will be like a multiplying symbol. So you can remember this with the multiplying symbol, and do this for 5 times, and move the hands in such a way that where you can follow the two thumbnails through your eyes, with your eyes. Do this for 5 times, and then the next motion will be a circular motion. A
No.
circular motion. Yeah, circular motion, and
Oh,
then
sorry. Okay. Yeah.
circular.
Sorry.
Yeah. Hold these two from left to a clockwise motion. Um, clockwise motion. You're doing anti-clock. So clock first,
Yeah.
and then
I
yeah.
think in the camera it is opposite. I'm doing
Okay.
clockwise like this. Yeah.
Okay. 1, 2, 3, 4, 5. And then do an anti-clock now. 1, 2, 3, 4, 5. And then completes it with the clockwise.
I think two motion is sufficient. Left clockwise and anti-clockwise.
We have to complete it with the clockwise, right? Yeah.
I think it is not there in the procedure. Maybe you can check that.
Just give me a second. I'll look at it. Prabhu,
If it is there, we can do, but in the book, it's just clockwise and anti-clockwise. You can try that.
Okay, yeah. Then we'll move on to the next one then. So hold these two
closer, 3 inches from the nose.
The nose, and then move
Good.
extend it, and then come back. And extend it and come back. Extend it, come back. So we have to do this for 5 times. And keep both the hands on your eyes for a minute. So when you do an eye palming, you have to start and keeping the hands on top, keeping the right hands on top of the left, and for a minute. And relax. So this is how we are ending up with the eye exercise. Let's go on to the slide, and then we'll go to the Kapalapati. Yeah.
Sure.
Thank you. Yeah. So next we are seeing the eye exercise. Just give me a second. Let me put on the slideshow. So we are doing these rotations. Just give me a second. Yeah, I'll quickly refer something and come back. Give me like 2 minutes. Yes, yeah. Let's go through the slides now.
We are not able to see your slide. Maybe.
I'm just sharing it.
Okay, good.
So we are doing the motions like how we discussed, and let's go to the benefits. Eye exercise eye muscles, all the external eye muscles and intraocular muscles are involved. It helps to cure the defective eyesight and tone up the muscle around the eyes. It prevents eye strain and other eye diseases. By regular practice, one can reduce the use of spectacles, corrects refractory errors. Next, we are going to see the Kapalapati. Yeah, we can see it and then go through the benefits quicker. Yeah.
Yeah.
So sit in Sukhasana and keep your right arm on the right knees and left thumb and left forefingers. We are using these two fingers. So left thumb finger on the left nostril and right thumb finger on the right nostril. So we are starting with left, holding the left nostril and do a forceful exhale.
Yeah. So you have to sit straight so that
Yeah, yes,
spine, neck, and head are straight. And then
yes.
hold the mula bandha, that is the lowest anus muscle. Just press the anus muscle and then
Mhm.
forcefully exhale on the right.
Yes.
Then close using the index finger and then release the left nostril and then
Mhm.
forcefully exhale on the left.
Yes.
Then again close and exhale forcefully. Inhalation is automatic, so no need to focus like. So you
So
have to hold the anus muscle throughout all 10 times until you complete the 10 cycle.
yes, hold the anus muscle and do this for 10 times. Exhaling on the right and then exhaling on the left is cycle one, and then do this for 10 times, and then take a minute relaxation, and you will be able to see the brain cells are getting activated. You'll see a sensation on your head, and after a minute of relaxation, focus on your head cells, and then start doing
Yeah.
the same.
Hold the anus muscle, forcefully exhale.
And do a relaxation for a minute and sit relaxedly, and then watch on the head portion, and you'll have a nice sensation. You can enjoy it like for some time, and then start doing the third time. So we have to do it for 3 times.
Hold the anus muscle again.
Do a relaxation for a minute, and that's when it completes the complete cycle of Kapalapati. We are going to see the slides. Thank you, Iya. Thank you for the demo. So Kapalapati should be done with eyes closed from beginning to the end of this practice. Retain Mula Bandham. That's what we are saying, like holding the anus muscle. During this practice, breath should not be retained or stopped. While exhaling, breath should be forcefully let out. Inhaling is done quickly but gently and naturally. Mouth should be kept closed at all times. Cycle 1, start by closing the left nostril, um, 10 cycles, and then 1 minute gap after this, second, and then 1 minute gap, third cycle, and then give 1 minute gap. The notice that those with high blood pressure, hernia, and heart problems need to get medical consultation before starting this exercise. Let's look at the benefits. Sinus problems are cured. Dust and other particles in the nose and sinus are removed. Body becomes energized. Supply of blood to brain increases. So this is about Kapalapati. Um, Ayya, Prabhu Ayya. Let me stop the presentation. Ayya, Ayya, Prabhu
வாழ்க
Ayya.
வளமுடன் ஐயா.
ஐயா வாழ்க வளமுடன். ஐயா ஒரு சின்ன we have a question here, ஐயா. So on the eye exercise, right? We
Yes,
have
ஐயா.
to do clockwise, anti-clockwise, and then completing with the clockwise 5 rotations, right?
Yes, ஐயா. I think sometimes we don't, sometimes we do. I think completing by again clockwise is think
It's
better.
recommended, right? Yeah. So
yes.
yeah, that's something I just want to clarify here, so everybody will be knowing it. Shivakumar Ayya, you want to share and then show it so that participants will be clear, Ayya.
Yeah.
So sitting on Vajrasana, and there is a motion we did on the eye exercise. So we start with clockwise. This side, Ayya. So clockwise is the opposite side, Ayya. Starting from here.
Actually, in the camera, it is showing opposite.
Oh, is it?
Yeah.
Can you do?
That's the reason I'm sitting in the side. From the side,
You have to start from here. Yeah. Yeah. Can you start it from here so that it will be
this
beneficial
is
for
left
the?
for me, this is right.
Okay. No,
I'm
even
keeping on the left and then rotate.
yeah, that is anti-clockwise. From left to right is anti-clockwise, right? From right to left is the clockwise.
Okay.
Yeah, you're doing right only. Yeah, yeah, yeah. No, the other side is correct. Yeah.
Yeah, yeah, whatever you did is right, ஐயா. Yes, ஐயா.
Yeah. 1, 2, 3, 4, 5. 5 times, and then we are doing the anti-clockwise. 1, 2, 3, 4, 5. And then again ending with clockwise. 1, 2, 3, 4, 5. So yeah, that's what I want to show you. Thank you, Ayya. So completing this with Kapalapati, and Prabhu Ayya will take over from here. Thank you, everybody. Thank you. Yeah, thank you, Ayya. Bye.
வாழ்க வளமுடன் ஐயா.
You want to show presentation first and then exercise?
Yes, ஐயா.
Which were
Give me a minute. ஐயா, for Chandrakumar ஐயா, he needs I gave him the link, but he is not able to join. Can you just check with him, ஐயா? Let me talk to him one minute.
ஐயா வாழ்க வளமுடன் பிரபு ஐயா. I can call him ஐயா. If you send me his number, I can call and check. You can
Yeah,
go ahead and see.
I talked to him. He needs the code. We'll take a minute. Anyway, everybody
Sure.
can take a couple of minutes break,
Sure.
and we'll
Sure.
start in a couple of minutes. Yes,
Sure. Thank you.
Chandra, looks like you were able to join. Chandra, can you hear us?
வாழ்க வளமுடன். என்கிட்ட கேக்குறீங்களா?
Not you. Chandra, he joined. Just, but he's on mute. I just wanted to check. I think he has joined, but that is fine. Let's. Okay, anyway, let me start. Chandra is there. We will show the demo, but let me start sharing the slides.
I can show demo if you want.
Yes, I think Chandra should be there. He is already joined. But
Okay, that's fine.
Okay, so thank you, Sivakumaria. Thank you, Karthikeyan.
Thank you. வாழ்க வளமுடன்.
Let's go to the next exercise. So we have seen all these things. Hey, can you hear me? Okay.
Yes, it is clear. Yeah. வாழ்க வளமுடன்.
Okay. So we are going to look at the next exercise, which is Makarasana. So Makarasana, right? It is actually the name, right? it connects to the crocodile. Okay. So what we are going to do in the crocodile, it has when it moves, right? It moves its back in a kind of it does in a different way, right? When it moves, it kind of shakes its back, right? So when it does that, there are some specific benefits associated with it. So Makarasana here, what we are going to do is we are going to exercise our backbone, which is the key for the health, right? The backbone, even though it looks like a single structure, there are the different regions, and you can twist and turn in different ways. The health of the backbone is very important because all the nerves are emanating from there. So the nerve health is maintained, right? And by the backbone is a lot of times it's the reason for weight gain, a lot of things. So it's very important that we exercise the backbone. So this is a very key exercise. So what we will do is that we will anyway go to the demo first. We will twist our backbone in a different postures, right? When you do that, different portion of the backbone gets exercised. So then that part is exercised. So any nerve pressure, everything is avoided, right? That's the core of the exercise. And let me see. Chandrakumaraya, are you able to hear us, or can you show your video here?
Yes, I can hear you clearly.
Oh, okay. Can you show? Let's go to the demo, yeah. Then we'll come back to the.
Yeah, sure. Can you see my video?
Let me actually stop sharing here. And yeah, I can see your video. Yeah, I'll pin it. Yeah.
Okay.
Yes. Yes. Yeah. Video is fine. Yeah. Maybe put it in a other mode. I mean, this is in a portrait. Which mode is there? Can you like 90-degree turn? Can we do it?
Oh, okay. Yeah. Let me try. I'm using the stand.
Yeah. Yeah. This is better. Yeah. Now the entire screen is your video. Yeah.
Okay. What do I have
And
to
you can go and
sunset?
hit it up and do it. Yeah.
Yeah, the first exercise.
Yes, yeah. Just lie down, yeah. Let me. We'll get.
Okay.
So lie down posture. You can. Anyway, we have done till. We are going to start the Makarasana, so we can go to the. You can lie down, and we will start with the instruction.
Okay.
Give me 1 minute. Yeah, I'm just. Okay. So what we do is now we need to twist our back in different times, right? So first, so keep your finger, like look at the fingers, the thumb and the index finger, make it like a ring, okay? And similarly on the other side, this is called Chinmutra, and keep your hand both sides, right? And yeah, keep your hand 45 degrees from your body, right? You can be 45 degrees, yeah, and keep the face upright. Now keep your legs together, right? And the feet together, all straight. Now turn your head to the right. Look at the twist. Turn your head to the right and turn the hip and the legs to the left. And don't raise the shoulders. And that is very important. Don't raise the shoulders. So similarly, now turn the head to the left side and body to the right side. Okay. Similarly, this is the key posture. We'll do it 3 times. Head to the right and body to the left. Right. This is 2 times over. Third time, right, head to the right, body to the left. Yep. So this is in the first, right? Now bring both the feet, legs near to your thighs. Yeah. Look at, fold your legs, bring it to your thighs. Yes. Now what you do is same thing. Keep your legs, everything together. Turn your head to the right and turn your legs to the left side 3 times. Similarly, head to the left, legs and the hip to the right side. Shoulders shouldn't be raised. That is very important. Second time. So what it does is, look at, yeah, then the legs have to touch the floors. That's important. And the knee, but at the same time, the legs shouldn't be separate. They have to be together, right? And shoulder shouldn't be raised as well. Yeah, that's the key. So what it does is, it twists the back at a certain position. Yeah. Okay. Now extend the legs. Keep the left leg, right, over the right leg over the left leg, crossed at the ankle, not on top. Yeah, crossed at the ankle. Not yeah, yes, crossing at the ankle. Yes. So right leg over the left leg, crossed at the ankle. Do the same exercise, right? Go to the head to the right, body to body and hip, and it touches. If you look at the fingers, the legs, fingers, toes, right? They are touching the floor. That is very important. So if you are not able to touch, it is fine. Don't stress too much. Slowly you will gain that. Okay. Right. Then left. Then put the left leg over the right leg, crossed at the ankle. Yeah. At the ankle. That's very important. Same exercise. Head to the right. Body to the left. Head to the right, left. Body then right. Second time. And the toes are touching the, and even the face. If it, yeah, third time. Yeah, one more time. Yes. Head to the right and head to the left. Okay. This fourth one is done. Now fifth one. Right foot or between the big toe and the next finger on the left. You see that between the big toe and this next finger, right? So you put your right foot's ankle there and do the same exercise. The shoulders shouldn't be raised. And yes, yeah, please go on. Head to the right, body to the left. Head to the left. So look at the legs are touching the ground. So this is a key exercise. Your body, unnecessary fat, your any back problems, for everything, this is a very key thing. So just ensure that you master the first step clearly. Yes, right, and one more left. Yeah, okay, that's fine. Yeah. Now keep the left foot on to the right foot's big toe and the next finger. Yeah, like that. The ankle placed on the, yeah, head to the right. So 3 cycles, everything, and head to the left and the right side. So each of this position, the backbone is twisted at the different places. So that's the, why do we do it in a different ways? Because we are twisting in a different places. Okay. Now put your thumb right inside your the other fingers. Yes. Put it inside and put it. Do it like a, yes, sir. And put it inside. Yes. Yeah. Like what I have done, right? Then do it like a cycling. So extending the, right? So you do it like a, when you both hands and the legs, you are doing like a cycling. Extend the legs as much as possible. Okay, yeah. Then relax as much as possible. Then just relax, right? Keep the legs separated. Just relax in this posture. So this completes the first part of Makarasana. There are two parts in Makarasana. First part is done. So in this way, we have to relax for 1 minute. Okay. Now let's go to the Makarasana part B. Look at how Aya is doing it. Always turn when you want to get up, when you want to lie down, go through the left side. That's very important. Okay. Aya, we can do the second Makarasana part B. Yes. Yeah. Give me, yeah. So how, look at the Aya on the left side, extending the, the left hand, then use the right hand and coming down. Okay. Now here there is no Chinmutra. The hands are facing the floor, right? They are not facing upwards. Two. Third one is your legs are together, the feet are together, and knees not touching the floor. Knees have to be above, and the shoulders not raised. Now both body and head will turn to the same side. Let's your head and body to the right side. Yes. If you look at, yeah, you see both will be facing for the feet and head facing the right side. But when you do that, look at the other, if now left side, right, the right hand, right palm facing upwards. This is the difference. Now come here, now head to the right, and the left palm starts facing upward and right palm goes down. So wherever it is facing, that face is down, the other face goes up. Okay, third time, if you see right is up now, right is facing upwards, left side. Yes, sir. So 3 times over. The key is the feet have to be together, knees not touching the floor, and shoulders should be raised as much as possible. Now fold, bend your legs, touching the almost the thighs. I mean, yeah, as much as possible. Yeah, feet together. Same thing. Head to the right, and head and body to the right. The left palm facing upwards, and go to the other side. Yes. So if you look at it, it's touching the floor. So that's important. But if you're not able to do, don't. I mean, like get into anything. But yeah, we'll slowly learn those things. In few days of practice, you will get it. So third, bring the legs back. Left, right leg over the left leg, crossed at the ankle. Yes. So same thing. Right head to the right and body to the right, and the left palm facing upwards. So we will share the recording as well as we will share the PPT, so you will get it. Yeah. Similarly, yeah. So everything is 3 times. It's very important. You start with the right, end up at the left side. Okay. Yes, sir. Now left for left leg over the right, crossed at the ankle. Yes. Okay. Same thing. Head to the right. And look at the palm, how it is facing. Yes, sir. Second time. Systematically twitch, like twist the backbone. Yeah. Okay. Now right leg. Yes, sir. You can take the phone. Yeah. Yes, sir. Yes, sir. If you need to talk, that's fine. Yeah. Pretty urgent. Yeah.
Sorry about that.
Yeah. No problem. So we are in the fourth position, right? Now left foot over the right. Okay, right over the. I think we have done the second one. I think we did the both. Now right, yeah, right. The big toe and the next finger over the left foot. That's very important. The big toe and between that, the left ankle is placed. Right. Now head to the right and body to the right. Yeah. And similarly go to the left side. So what we did, the big toe, between the big toe and the next next toe, you have you are placing your right leg over the left leg. So whatever we have done in the for the down, yeah. So now the left foot, left big toe and the next finger over the right hand. Yeah. Look at, yeah, the knee, everything have to be, knees shouldn't be touching, and for shoulders shouldn't be raised. That's very important for the proper twisting. Yes. Yes, yeah. Yes. Would be. And palms, you look at how palm position changes, and the foot needs to touch the floor. That's very important as well, as much as possible. If you are not able to do, slowly in the practice it comes. Third cycle. Okay. Now the 6 things are done. Now, like a crocodile, right? We need to. What you need to do is, so far in the exercise you can close your eyes. For this one, you need to open your eyes. Raise your hand slightly right above the ground, and your touch both the hands, right. The middle fingers should be touching it, and slightly middle fingers should be touching it, and your eyes should be looking at the middle finger. Yes, sir, you can extend the hand little more further away from it. Yeah, yes, sir. And when you turn on the right side, the right leg, you fold the right leg and touches the right thigh. Yes, sir, you can do it that way. That way it explains here. You see, when you turn on the left side, the left foot touches. When you turn on right side, so your eyes are focused on the middle finger. You slightly raise to your body and doing this exercise. This is like the movement of crocodile. This really helps in, the whole body flexibility is established by this way. Yes, yeah. Five times, right? Both sides, you do it and relax. When you look at the position of relaxation, it's like a child. How does a child relaxes, right? You are on the right side, your head facing the right side, right? The right hand is just in a V shape, right? And the left palm is facing upwards. Left hand like that. When you sleep like that, you're like a child, relaxed person, right? You like that. And right leg is slightly up and bent. Exactly the way Aya has done. Okay, relax in this way for 1 minute. Let's quickly go through the slides. I will share my screen. Yeah, then we'll go to the other next. So Makarasana. So we did Chinmutra, like thumb on the next finger, like a ring, right? And do all the different twist and turns, right? So basically, head to the right, body to the left. So different postures: straight, holding legs, then right leg over the left leg, then left leg over the right leg. Then between the big toe and the next toe, you keep the other leg. So we'll share this slides. Then finally you do like a cycling motion, right? Relax for a minute. Then similarly now part B. Part B we did Basically, like body and head will be facing on the same side, but the palm on the other side has to start with the both will be on the facing downwards, but when you do the exercise, the other side of the palm has to face upwards. So that's the movement that happens. Okay, you do it all the different 5-6 postures. Then finally you do a crocodile movement, right? Almost five times you can do, and relax in the child posture. Okay. So Makarasana, it's like a big, huge number of benefits. So it strengthens the abdominal muscles. It normalizes the activity of endocrine glands. Helps to cure arthritis, sciatica, high blood pressure, hip pain, spinal pain, neck pain. So many of our current lifestyle, this is a critical exercise. We do maybe other walking and other things that is fine, but you need to really touch the core, which is your backbone. So this is very important. So the spinal column is systematically twisted from bottom to top. The backbone and the disc get strengthened. Don't overdo it. Do it. I mean, like you should be comfortable when you do it. All nerves emanating from the backbone are strengthened. Legs and abdominal regions are strengthened, and obesity is reduced. So immediately, I mean, like when it comes to obesity, right? You have additional fat on the side of your body, front of your body, right? Specifically on your stomach region. You can see the results in within 10 days or so when it comes to obesity. Like you will see that the unnecessary fat is getting reduced. That I have seen many times. So this is a good exercise for reducing the obesity. And for women, it regulates the menstrual cycle and helps to cure uterus problems. Okay, let's move on to the massaging. So massaging is about now that we have done so much exercise, uh, 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 like your biomagnetism, right? In your body, the energy level is it's all triggered, right? It's there. Now let's we want to just use that thing just to massage your important organs so that the energy flow in those areas are maintained better. Yes, you can share your video. I'll stop sharing. Then we'll go.
Sure.
Yes, yeah, I can see it. Yeah, you lie down always on the left side. Yes. Okay. So massaging. Let's first start with the massaging the. Use your right hand, right palm, right, and put it on top of your navel region, and rotate 5 times, 3 times, 5 times clockwise, then anti-clockwise. So if you are at home, like you can do it over your body directly. Again, clockwise, anti-clockwise, always end with clockwise again 3 times. Okay. Now then take the right hand to the left chest. Yes. Yeah. Left chest region again 3 times. Clockwise, anti-clockwise 3 times. Clockwise 3 times. Now use the left hand, left palm on the right chest. It will be like when you rotate right this time, it will be starting with anti-clockwise. Only in this position it will start with anti-clockwise 3 times and clockwise 3 times. It's a natural rhythm will look like that. Okay. Again anti-clockwise 3 times. Okay. Next for the ears. Do the so ears you will yeah. So fold your other 4 fingers and the thumb should be facing outwards. Put those into the ear pit inside the ear pit and rotate. Okay. Clockwise 3 times, anti-clockwise 3 times, 3 or 4 times, and again clockwise 3 times. Yes. Then what you do, you actually massage the earlobes, right? Use the the thumb and the next finger, right? Massage the earlobes from the top to bottom, bottom to top, and top to bottom. So the lot of nerves from brain ends there. So you massaging it is good. Next is use the, just extend your fingers, use the thumb and put it on the temple, which is on the side of your forehead, right? Temple region, which is soft region. Put it there, rotate, press, slide, press, rotate 3 times clockwise, 3 times anti-clockwise, and 3 times clockwise. Okay. Now use the little fingers to massage your nose, like this. Yeah. Yes. So use the little fingers, right? Just from the bottom to top, 3 to 5 times. Yeah. Okay. Now finally massaging the face. Put it all the whole the palms, right? Yes, like I have shown on the right side, left side. Then rotate in a clockwise direction. Yes, only clockwise, no anti-clockwise. The whole from face to head. It will really clears the any blood flow on the face, and you will your face will look fresh. Okay, that ends the massaging. Relax. Okay. Now let's go to the acupressure. I'll show a quick acupressure thing, the slides, yeah, acupressure also. Then we'll come back with them.
Yeah.
So massaging, we have seen that any energy, magnetic flow issue, right? It gets solved. So different positions we did. Earlobes, a lot of certain nerves are ending. So you would have seen that if some kids are not studying well, they are not doing things in India. We are in even in the temple, right? We touch our earlobes and do the I don't know the English term for it. So what happens is that it activates the nerves and it improves your intelligence. Temple, we do the nose and finally the face. So it regulates the flow of biomagnetism in stomach and chest. Internal organs are strengthened. It helps to cure the hearing problems and regulates the function of the ear. And it also regulates the blood circulation in face and makes the face bright. Okay. So quick introduction about acupressure, then we will see the demo of it. Acupressure and then relaxation. So acupressure is a technique from ancient wisdom and modern scientific knowledge makes it rational and acceptable in the present day. So you would have heard about acupuncture, where you actually punch with a needle, right? Here you are actually only doing the pressure. Okay, so you in any system, right? Even taking the home, the pipes and everywhere, right? When there is a problem, these are the areas where it can get locked. That's where the kind of junctions. Once you make the flow right in those junctions, then the whole flow in the whole home, the water flow or whatever flow would be better. Similarly, in the body, there are specific places where by giving a pressure, you are regulating the entire body's magnetic and energy flow. Okay, so that's the concept of acupressure. So what do you do? In the left hand, right? Left hand, 3 middle fingers, right? Leaving out the little finger and the thumb, the 3 middle fingers should be touching the neck region, the soft region, after the backbone ends, the neck region, right? There, you touch those 3 fingers there, okay? Left hand, till the entire exercise, it should be touching that way. And we will use the right hand index finger or the thumb finger to put pressure on different places for 30 seconds. There are like totally 14 places, right? 14 places. So 14 into 30 seconds, 7 minutes. This exercise takes 7 minutes. The different postures are, you start with the, first you put the left hand, three fingers on the neck, right? The top of the neck, where the soft portion after the spinal cord ends. Then the right index finger, you start from the chest cavity bit, right? That's the second. Then 1 inch below, that would be the third position. Another 1 inch below is the fourth. Then on the navel, right? You put a pressure with the little finger, you put the pressure on the navel, press it, then pull it towards on the top, like a clock, right? That will be like fifth. Then use the thumb, push it down, right? That will be 6. Then seventh would be to the right side, like in the clock 10:30, right? Towards your chest end, that will be 7th. 8th would be like 1:30 in the clock. 9th would be like 7:30 in the clock. All pressed in the navel region, right? And 10th would be like 4:30 in the clock, right? So you you actually just pull the navel in the direction and just hold it for 30 seconds. That's what you do. I anyway will explain. And the 11th would be like just directly below your nipple, right? In the rib cage, that soft portion, that will be the 11th position. First to start with the right side, then on the left side. 11th and 12th. Then 13th would be the rightmost rib cage, right? Rib cage, when it ends, before the hip starts, there is a soft portion. You use your thumb finger there, right? And to put a pressure, that is 13th position. And 14th would be between your left groin region or thigh region, right? And the navel in the middle. So that kind of helps the all this colon and other things, right? So it helps those things. So these are the different position you apply pressure. Okay. Now this is very important. It really relaxes the energy flow, right? A lot of times it gets stuck and it gets into emotional, we get into emotional problems and other things, right? Because of a lot of times it is energy blocking is one of the main reasons. So acupressure is also a very key exercise. Let me stop sharing. Let's go to IS demo. Yeah, we can start with your demo. Yes, yeah. So similarly, it's very clear, yeah. Now very close. Yeah. So generally, it's good to do with directly your fingers touching the skin, but for demonstration purpose, we will have the clothes. So you start with the left hand, right? The 3 middle fingers, right? Not the, take it to the below. So you can show it first in the standing posture, yeah? So where do you put it? You take the 3 little middle fingers, right? After the spinal cord ends, there is a soft portion before it reaches the head, right? In the neck. Spinal cord ends there, and but above that, right?
Is that right here?
Yes, yeah. You can little bit above. Yeah, the 3 fingers. Yes. So that's how you keep the 3 fingers, that soft portion, till the end of the exercise. Okay. Yes, yeah. You can go to. It's clear. Yeah. You can go to the. So these are all scientifically. See, I mean, like we do gym exercise, walking, this and all. It's all fine. It increases the flow, right? This is like doing it in a best possible way, so you get the entire benefits. Okay, so the left hand will stay like that till the end. Left fingers touching the soft portion above the spinal cord, the neck. Now use the right index finger, put a pressure in the, for 30 seconds is done. So index finger, right, on the chest cavity. The way I explained it was explained in the picture, right? Between the, yes, after the that end, right, when it ends, the soft portion, yeah. Slight pressure applied for 30 seconds. Other fingers are not touching the body. You can feel when you do it, the energy flow getting cleared. Okay. Once 30 seconds are done, then take 1 inch below, right? Put a pressure, 30 more seconds. Relax. Now breathing and all normal. Maybe 8 breaths, 30 seconds to understand you are breathing like 8 times or 9 times. Yes, yeah. Next, 1 inch below, and you are still not touching the navel. So between the, you can say that between the navel and the chest cavity, you have to press 2 times, so you know where to put pressure. Yeah, 30 more seconds there. Okay. Now use the index finger. Go to the navel, middle of the navel. You are pressing it. Middle of the navel. Pull it upwards to the 12 o'clock, right? Pull it. Aya is pulling towards the chest. It's like in the clock, 12 o'clock. So navel is pulled towards the chest. 30 seconds there. There are 3 places we use our thumb. When we do the exercise, I will tell you. 6, 10, and 13 are those things. 5th, we are doing the 5th now. Okay, 30 seconds are done. Now use the thumb, this place, put it in the navel, toward downwards, towards your legs, like 6 o'clock in the clock. So each of these things clears the energy flow for different organs, right? The exercise that we do generally, it doesn't really help the organs, right? It helps, like, I mean, when you do certain exercise, energy flows, but this is like systematically designed. Okay. Now put the again index finger towards the right chest corner, the corner of your right shoulder, right? So it will be like 10:30 in your clock. Put pressure and pull the navel towards the right shoulder. It's like 10:30 in the clock. You are pulling towards that. Okay. Now use the index finger again now towards the left shoulder, like 1:30 in the clock. Like pull the navel towards that. You're pulling towards the left shoulder. Then towards the right groin region. So it will be like 7:30 in the clock. The navel region, again index finger, towards the right thigh or right groin region. 7:30 in the clock, if you consider navel as a clock. This is the 9th position. Okay. And the 10th would be towards the left thigh region. Use the thumb again. The 10th, 3 times we use. This is the third, second one time. Basically in the 4:30 in the clock. Basically, you put a pressure on the navel and pull it towards the left region. A lot of nerve endings are there at the navel. Okay, 10 steps are take 2 more breaths and the yeah. Okay, now let's go to the take the from right nipple, right? Just go below, above, then cross the rib cage. There is a soft portion, right? That end, yes, just put your index finger there, press there. If you put a straight line above, it should be your nipple straight line there, but you have to press on the soft region below the rib cage. 30 seconds. Okay. Now go to the similarly on the left side. Yeah, left side, just below the rib cage in the middle. Yeah, directly to the nipple. Yeah. So you put a straight line, that soft region. Again, index finger. Okay. Now use the thumb on the right side at the end of the rib cage, right thumb at the end of the rib cage, before the yeah, there, right before the hip bone starts. There is a soft portion, right, on the rightmost. There, use the thumb, put a pressure. 30 seconds. Yeah. That's the 13th. So 6, 10, and 13, you use the thumb. Normal breath, no stress anywhere. Okay, cool. So now last one. 14th one, use the index finger again between the navel, between the left groin region. Take the middle, around that, yeah, yeah, somewhere middle there, yeah. Maybe little below, yes. You are not touching the navel. Between the navel and the left groin, somewhere in the middle, you press it with your index finger. Yes, I think now we can take the right hand, then take the left hand out of there, relax for a minute. Okay, this is Makarasana. Okay, now let's do the relaxation as well. Then we will, yeah, let's close the relaxation as well. Then we will do the benefits. Yes, yes, so that we can logically. So last one, relaxation. Give us, I think we should be done in quickly. Then we will close this. Okay. So in the relaxation, you have to feel that you just close your lie down on your back, keep the legs relaxed, right? And keep the legs like 1.5 feet apart. Close your eyes. Keep the hands relaxed, right? With the palms facing up as your eyes there, right? Start relaxing the body from the feet upwards, right? Relax all the 10 parts of the body, right? We start with the feet. So think of your feet and start relaxing. We're relaxing. What do you need to do? My feet are relaxed. Blood circulation is good. Heat circulation is good. Air circulation is good. Life force circulation is good. Magnetic energy circulation is good. I'm getting sufficient strength in my feet. Let them take a rest. The feet are relaxing, relax, relax, relax. So basically you are relaxing. You are giving an auto suggestion and relaxing. So we have to do the same thing for everything. Next, relax the the legs, right? We start with the feet, then relax the legs, calf muscles, right? The feet and the feet, legs are relaxing. Relax the knees. Relax the thighs. You have to feel that it is relaxing. Relax the abdomen region. Relax the stomach. Relax the chest. Relax the shoulder and arms. Relax the neck. Finally, relax the head and face. Okay. Now you need to start from the head to the feet. What you need to do is, okay, the head is relaxed. Now you are saying earlier, relax, right? Relax, relaxing. Now you have to assume that it is relaxed. The head is relaxed. The neck is relaxed. The shoulders and arms are relaxed. Chest is relaxed. Stomach is relaxed. Abdomen is relaxed. Thighs are relaxed. Knees are relaxed. Calf muscles are relaxed. The feet are relaxed. The whole body is completely relaxed. Keep the eyes gently closed. You can lie down, depending on, you can lie down about 10 minutes. It will be really a relaxing thing. If you have other things, you can at least lie down for a few minutes. And if you feel sleepy, you can sleep for a few minutes as well. A lot of people sleep at this posture. So while getting up after this exercise, first gently move the fingers, hands, legs, and body. Always roll over to the left side and I'll slowly get up. So for people, anybody suffering from insomnia, acupressure and relaxation exercise can help get very good sleep. Okay. Thank you, Aya. Thank you very much. Yeah. D plus by the divine. Let me share the screen. We'll close the things quickly. So we started talking about acupressure, different positions. So different positions, it helps in the different organs in the body. It doesn't cover every organ of the body, but a lot of key things are covered. Chest and stomach, that's where your key organs are there. Benefits of acupressure: short circuit of electrical energy in any part of the body would be cleared. Preventative for heart ailments. So heart-related problems, this is really good because there is a block, right? This kind of clears. So any heart-related problems, this is a big plus. Reduces blood pressure, regulates nervous system, and reduces tension. Helpful in alleviating insomnia, energizes internal organs. Okay, these are benefits of acupressure. Relaxation, we did. Benefits are regulates the circulation of blood, air, life force, and biomagnetism throughout the body. Whole body is completely relaxed and tension in the body is relieved. Body gets full rest, brings calmness to the mind, reduces blood pressure, prevents heart trouble. summary. So physical exercise are as important as meditation or anything else, right? Because when your physical body is good, your the mind will be good. So when you are free of physical problems, then only you can enjoy, you can do better thinking, you can excel in everything when you are comfortable with your physical body, right? Both healthy and fit, right? It's very important, and that itself it's like a big booster, right? And the exercises given by Makarasana, it's about, after long research, covers the entire body, right? And it's a blessing. So you definitely, it's a plus to learn this exercise. And daily practice pays dividends like no other, prevents and cures diseases. All parts of the body from head to feet become healthy, rejuvenates the whole body, helps to build very high immunity. So whenever you do the exercises, like, you will not feel tired till the end of the day. And every day is you need to do it. If for women who are pregnant, don't do the Makarasana part 2 or the neuromuscular bending the exercise, right? Don't do that. As much as possible, you don't do too much of that. But other than that, no issues. And don't stress too much. Ensure that you don't. You should feel comfortable. Just because we said that the head and then the toes have to be touching the ground, don't stress. I mean, like, whatever you can do it slowly. The flexibility will improve. I think that's all. P plus by the divine. Any questions? So I just want to check. Pranay, are you from which center? Are you in contact with anyone?
Yeah, I'm from Kansas City, and I'm Srinivas Kalki.
Kalki. Okay. Then as long as you are connected with someone, it is fine. We will anyway. Are you in any WhatsApp group?
Yeah, I just joined the group which is sent in the chat today.
Okay. It is Central Zone Aspirants.
Yes.
I went to the Kaya Kalpa and exercise group.
Okay.
I'll send it.
Okay.
Yeah, if you can send
I'll
that,
this PPT, yeah, and then yes, P plus.
all right.
Any questions? Anyone? Pranay, anything that you want to? Any quick questions that you want to ask?
No, nothing right now. I like these exercise. Actually, I've been Srini actually sent me another video. I just kind of got introduced to these. So it's good for me. I'm having some sinus issues, and I think it's helping me right now.
Okay. Definitely it will help. Yeah. So and Srini, yeah, I mean, if you be in touch with Srini, so it is really helpful. We spend some time on a regular basis, and it's like our extra additional, like, what do you say, tool or mechanisms to help ourselves. So okay, P plus.
Thank you. Yeah. Thank you so much.
Yeah. There is nothing else. We will conclude the session. Thank you all. Let's conclude this session with the blessings for the world. May rain pour on all parts of the world timely and sufficiently. May food grains grow abundantly to the satisfaction of all living beings. May the leaders of all nations progress in spiritual knowledge and do good services to humanity. May the whole world enjoy prosperity, happiness, and peace. May the whole world enjoy prosperity, happiness, and peace. May the whole world enjoy prosperity, happiness, and peace. P plus.